Hello everyone. In this video, let us see about the congenital anomalies in children.
I am Dr. Celeste Mary, Vice Principal in Administration at Tripplum College of Nursing.
Objectives. By the end of this session, learners will be able to define the term congenital anomalies, explain the causes of congenital anomalies, list the risk factors, enumerate the diagnostic approaches, enlist the common congenital anomalies in children, and discuss the preventive measures of congenital anomalies. Next, we can move on to the definition. Congenital anomalies can be defined as structural or functional anomalies that occur during intrauterine life. It also called as birth defect, congenital disorder or congenital malformations. These conditions develop prenatally and may be identified before or at birth or later in life. Moving on to causes of congenital anomalies, genetic factors, examples chromosomal abnormalities and mutant genes. Next, about the environmental factors, it can be the exposure to medicines, chemicals or other toxic substances and infections during pregnancies, lack of certain nutrients. And combined with genetic and environmental factors, that is multifactorial factors, are reason for the congenital anomalies in children. Next, about the risk factors, advanced maternal age, example the condition is Down syndrome, consanguineous marriage and the maternal malnutrition, examples of iron deficiency or folic acid deficiency during the first trimester. Moving on to diagnostic approaches, it can be prenatal diagnosis and postnatal diagnosis. Under prenatal diagnosis, the investigations are amniocentesis during 14 to 16 weeks and about the chorionic villi sampling, maternal serum alpha fetoprotein, gonadotropin testing and fetoscopy, X-ray and ultrasonogram, protein assay, DNA diagnosis and pre-antenatal screening. All these are the investigation can rule out during prenatal diagnosis method. And postnatal diagnosis, the investigation can be the maternal and family history, physical examination, biochemical assay and hormonal assay, blood test, radiography and ultrasonography. These are the method of diagnostic approaches to rule out the congenital anomalies in children. Next, we can see about common congenital anomalies in children. Moving to central nervous system, neural tube defect. It consists of spina bifida occulta, spina bifida cystica. Spina bifida occulta is a mild form and it is sometimes called as hidden spina bifida, where there is a small gap in the spine or a tuft of hair in the spine. And other type is spina bifida cystica, meningeocele and nilomeningeocele. Meningeocele is a birth defect. There is a sac protruding from the spinal column. It includes the meninges, the spinal and spinal fluid, but does not contain the neural tissues. Whereas the nilomeningeocele, it is a severe type of spina bifida in which the membranes and the spinal nerves and the spinal fluids are protruded through the spinal column. And moving on to the other conditions as encephalocele, anencephaly, microcephaly and hydrocephalus. And about anencephaly is a serious birth defect in which the baby is born without the parts of the brain and the skull. Whereas the microcephaly is a condition in which the baby's head is smaller than the average for an infant size and age. And about the hydrocephalus, it is a condition in which an accumulation of cerebrospinal fluid occurs within a brain. Next, about the congenital malformation in respiratory system, choanal atresia, diaphragmatic hernia, pulmonary agenesis. Moving to choanal atresia, it is a narrowing or blockage of the nasal airway by tissues. Next, about the diaphragmatic hernia, it is a birth defect in the where there is an abnormal opening in the diaphragm through which the abdominal content is protruded into the chest. And about the pulmonary agenesis, it is a complete absence of one or both the lungs, including the bronchi, bronchioles, and vasculature and the respiratory parenchyma. Next, we can see about the cardiovascular system. Under that, congenital heart disease, it consists of Asynotic heart disease and the cyanotic heart disease. Under asynotic heart disease, ventricular septal defect, atrial septal defect, patent ductus arteriosus, coarctation of aorta, pulmonary stenosis, aortic stenosis. And about the cyanotic heart disease, the conditions are tetralogy of Fallot, tricuspid atresia, transposition of great arteries, and dextrocardia. We can see one by one. Atrial septal defect. It is an abnormal opening between the right and the left atrium. And about the ventricular septal defect, it is also an abnormal opening between the right and the left ventricles. Moving on to patent ductus arteriosus is a condition in which the ductus arteriosus remains opened, and coarctation of aorta is a narrowing or constriction in the portion of the descending aorta. And moving on to the tetralogy of Fallot, it is an cyanotic heart disease characterized by ventricular septal defect, pulmonary stenosis, overriding of aorta, and right ventricular hypertrophy. And about the transposition of great arteries, in which the main arteries like pulmonary artery and the aorta are originates in an opposite direction, and it is an embryonic defect. Next condition about gastrointestinal system anomalies. Here the conditions are cleft lip, cleft palate, tracheoesophageal fistula and esophageal atresia, pyloric stenosis, Hirschsprung's disease, omphalocele, gastrosis and anal atresia. You can see one by one. First one is a cleft lip and cleft palate. It's an abnormal opening or slit in the upper lip and the roof of the mouth, that is called as palate, or both the lips and the palate. It is a facial malformations. And about the tracheoesophageal fistula and atresia, it is an abnormal connection between the esophagus and trachea. Esophageal atresia means it's an absence of the opening in the esophagus. Pyloric stenosis is a thickening or narrowing of the pylorus, that is muscles of the stomach. And about the Hirschsprung's disease is a developmental disorder characterized by absence of ganglions in the distal colon and is otherwise called as megacolon. And about the omphalocele and gastrosis is a congenital defect of the abdominal wall resulting in intestinal herniation from the umbilical cavity. And this omphalocele, there is a sac covering of the abdominal content. And about the anal atresia is an absence of anal opening. Next about the genitourinary system disorder, renal agenesis, horseshoe kidney, polycystic kidney, hydronephrosis, hypospadiasis and epispadiasis, undescended testes and phimosis, etc. First about renal agenesis is a complete absence of one or both the kidneys. And about the horseshoe kidney is also called as renal fusion, where there is two kidneys are fused or joined together. And about polycystic kidney, it is an inherited disorder in which the clusters of cysts develop within the kidneys. Here the condition hydronephrosis is a condition in which one or both the kidneys become swollen due to incomplete emptying of the urinary tract. Moving to hypospadiasis and epispadiasis is an abnormal urethral opening in the penis, where the hypospadiasis is an abnormal opening in the ventral aspect of the penis, whereas the epispadiasis is a dorsal surface of the penis. And moving to undescended testes is also called as cryptarchidism. It's a condition in which one or both the testes are now descended into the scrotum. Next condition is musculoskeletal system disorder, clubfoot, congenital hip dislocation, polydactyl, syndactyl, plecomelia. First about the clubfoot is a birth defect where one or both the feet rotated inward or downward, and it is also called as talipes. Moving to congenital hip dislocation is an abnormal formation of hip joint during the early stages of fetal development. And about the polydactyl, here the child had extra digits. And the syndactyl, here the two or more digits fused together. And about the plecomelia is a rare birth defect characterized by malformations of extremities. And these are some of the congenital disorders. Blood disorder examples thalassemia. This means a hereditary hemolytic disease caused by faulty hemoglobin synthesis. And hemophilia is a bleeding disorder. Sickle cell anemia, congenital spirocytosis. And about the congenital metabolic disorders, cystic fibrosis, phenylketonuria, Wilson's disease, and glycogen storage diseases. These are the examples. And moving to the congenital endocrine disorders like growth hormone deficiency and hypothyroidism, that is called the cretinism, hyperthyroidism, diabetes, and about the chromosomal disorders like Down syndrome, Turner syndrome, and Klinefelter syndrome, etc. Finally, preventive measures: avoiding the consanguineous marriages, avoid the late marriage and pregnancy after 35 years, promotion of good girl-child health, and by preventing the malnutrition, anemia, folic acid deficiency, and about the immunization by anti-immunoglobulin to the Rh negative mothers after abortions, and avoidance of drug intake without consulting the physicians during the first trimester of pregnancy, and about the efficient antenatal care has to be provided, and the prevention of intrauterine infections, promotion of therapeutic abortion after the prenatal diagnosis, and increasing the public awareness about the risk factors and etiological factors of congenital anomalies. Thank you.